Good morning. I am David. I work here too. And this morning we're going to talk about lead poisoning, and specifically we're going to talk about the work that we've been doing in Toledo with advocates there to pass a lead-safe ordinance for rental properties in the city of Toledo. So this morning, briefly, we're going to talk a little bit about that work. I'm going to hit actually the mapping fairly hard. We aren't going to talk a whole lot about the advocacy campaign. Kind of the on-the-ground, boots-on-the-ground work that the advocates in the Toledo community did. Although in the Q&A, if you would like to talk about that some more, we can certainly explore that as well. But I'm going to focus primarily on the mapping work that we did, because the mapping work and the analysis really was what kind of tilted things in favor of passing the ordinance. Then I'm going to go back and look at a little bit about the history of why our communities look the way they do. Why does Central Toledo have the problem with lead that it does? And then we'll wrap up with some implications for policy and practice. Now, when you think of lead poisoning, what's the first thing that comes to mind? Well, if you're like me, when I first heard about this project about 3 years ago, it would probably be something like this. Are you serious? I mean, didn't we fix lead poisoning in like the 70s or so? And it's true that we did pass legislation in the 70s to remove lead from house paints, and in the early 80s to remove lead from gasoline. But we still face problems with lead. And so those of us who weren't living in those areas where lead poisoning is a problem were pretty clueless that it actually still was. So you might also think of images like this. We've all heard about Flint, Michigan. It's about 100 miles north of Toledo. And it's really placed lead poisoning front and center in the public consciousness. And as tragic as Flint is and continues to be, Flint, Michigan is actually an outlier in the sense that most of our major metropolitan areas face the same kinds of issues with their water infrastructure as Flint faced, but it was criminal negligence in the case of Flint that led to a cascading series of events that released lead and other toxins from the water distribution infrastructure and caused all kinds of problems for the residents of Flint. And in fact, if you saw this announcement for this session this morning, the graphic for this session was also a faucet with water running out. Now, again, in the Q&A and later in the discussion, if you want to talk about lead in water, we can explore that as well. But I'm going to focus primarily on the primary way that most children are lead poisoned in the United States today and in many parts of the developed world, and that is through exposure to degraded lead paint and also some exposure to lead present in the soil. Now, the lead present in the soil could be there by precipitation from when we did include lead in gasoline, and it also could be there, especially close to the foundations of a home, as a result of the home being painted in the past with lead paint that was subsequently scraped off and fell into the soil. Well, before we get into the research around the ordinance, let me just tell you a little bit about lead poisoning, the signs and the symptoms. And these are pretty much the signs and symptoms of acute lead poisoning. You generally don't see symptoms terribly intense in children, which is part of the problem if a child is lead poisoned. Oftentimes the symptoms can mask other conditions and go undetected unless lead is specifically tested for. But irritability, difficulty concentrating, headaches, a loss of appetite, muscle and joint weakness, and then longer term we also see cognitive deficits in children and adolescents because the damage that's done by lead poisoning is permanent, unfortunately. Lead acts as a kind of mimics calcium. They're both divalent cations, if you want to know the chemistry. What that means is that when they're in their ionized form, they both have a +2 charge. And what that means for the physiology of young nervous systems is that in the places in the nervous system where calcium should be, lead will substitute and cause permanent damage to synapses, the connections between neurons that are so important for neurons to speak to one another. And again, that damage is irreversible. Now, children can receive intensive therapy later on to help make up for some of those cognitive deficits. But the bottom line here is that lead poisoning has long-term effects that result in both personal damage, personal injury to children, and personal effects, and also societal costs. It costs money to do that remedial work with children and adolescents who suffered from lead poisoning. And the workforce also suffers from the diminished capacity of folks who in their youth were lead poisoned. So it's vitally important that children be tested. Not only is it vital, it's the law. Now, this is that slide where you know it's going to be in everybody's presentation where they say, I know this is too small to read. Well, I know this is too small to read, but what you see here is a questionnaire on the left side of this sheet that's administered to parents to determine whether their child should be tested. And on the right, that very, very fine print is a county-by-county listing of the zip codes that the Ohio Department of Health has identified as high risk for lead poisoning. Now, I've enlarged the most important part of that very, very small print to show you the questions that are most relevant to our conversation today. Does the child live or regularly visit a property built before 1978 that has peeling, chipping paint, or recent or ongoing renovations? And those two things are important. Now, when we think about children ingesting paint, a lot of times the image that comes to mind is of a child eating paint chips. And while that is a way that children can ingest lead paint, it's not the only way. And in fact, children can ingest lead dust from deteriorating lead paint that has created dust on the floor when the child crawls or on a windowsill, when the child reaches to the windowsill. All kids put their hands in their mouths. Parents will say, my kid doesn't. They've done studies. All kids put their hands in their mouths. And so children who have lead dust on their hands, on their fingers, can ingest it when they have that hand-to-mouth contact. The reason that date 1978 is important is 1978 was the date at which lead paint was supposed to be completely removed from the supply line for new residential construction. So if a child is living in those circumstances, then they need to be tested. Is the child on Medicaid? If the child is age 1 to 2 and on Medicaid, they need to be tested. If the child is up to age 6 and doesn't have a history of being tested and is on Medicaid, the child needs to be tested. And finally, any child who resides in a high-risk zip code area under the age of 6 should be tested. And that's going to be important for our conversation because we don't really have complete data, or at least we as researchers, it's very difficult for us to get Medicaid enrollment data, but it's very easy to identify zip code areas. And if we identify those, we can say specifically children under 6 who live in those zip code areas should be tested for lead. So if you don't know, Toledo is on our north coast. It's on the western end of Lake Erie. It's the county seat for Lucas County. It's also the city with the second highest incidence of lead poisoning in the state of Ohio, second only to Cleveland and Cuyahoga County. Now, what we're going to talk about this morning is this document. This is the draft of the lead ordinance that was championed in the city of Toledo. The requirements of the lead ordinance were that owners of properties, 1 to 4 units, rental properties, were required to have their properties tested for lead. And that testing needs to include what's called a dust wipe test. There's actually a wipe that is passed over surfaces in the home and sent off to a lab for analysis to see whether lead is present. And that has to be done by a certified lead inspector. If there is lead found in the home, if there's lead found in the home, then the ordinance requires that interim measures be implemented to take care of that lead hazard. Now notice that interim measures are not abatement. Abatement means you completely remove lead from the property, and that's not a requirement of the ordinance. The ordinance was a compromise between full abatement and nothing, and it actually involves things that a property owner should be doing to their property anyway to properly maintain it. Things like painting over surfaces that need painted. Because even if there's lead paint present in the home, if it's encapsulated or covered over even with regular paint, that's enough to protect the occupants of the home from dust. You also can get friction on casement windows and door jambs, and if those have been painted with lead paint in the past, that can produce dust that also could be a problem. And so maintenance of doors and windows, if possible, replacing windows, but that's not an interim measure that's required. And then finally, if there is bare soil under the drip line outside the home, and the drip line, if you think of a gable roof that has an overhang like this, and then water dripping down outside the home, anywhere inside that area, if there's bare soil there where children can play, that's also an area where lead dust could have accumulated in the past. And so if you just plant something there, grass, flowers, whatever, anything to both fix the soil and to keep your children from going into those areas, that would be enough as an interim measure to ameliorate the problem. Now, I said a minute ago that we as researchers have some difficulty in getting Medicaid enrollment data, and that's one of the criterion by which we determine whether a child should be tested or not. But we also have a third criterion, which is whether the child lives in a high-risk zip code area. And I think you can see from the map here, the green area is the city of Toledo, that kind of cross-hatching area, and all of those blue outlines are identified as high-risk zip code areas by the Ohio Department of Health for lead poisoning. So as you can see, the entire city, save that small portion to the northwest, is covered by high-risk zip codes. In other words, every child in the city of Toledo under the age of 6 should be tested for lead according to the state law. Well, how many children is that? Now, we're just going to assume that the entire city is covered by high-risk zip codes. That small area to the northwest is fairly sparsely populated. And so if we break it out by age group, children under 6, there are about 35,400 or so children from the 2010 census that resided in the city of Toledo. And we use the 2010 census because that particular census both is a full count, and it also lets us break out single years. The subsequent American Community Survey gives you predefined age intervals, and we can't break out that 0 to 6 category very easily. Now, keep in mind, though, that this 35,000 or so is a point-in-time measure. And so every year, kids have a tendency both to be born, and under the right circumstances, they have a tendency to get older. So every year, about a sixth of that group is going to age out. They'll turn 6. And about a sixth as many children will be born into that group. So this is a moving number. When we look at the test results data that we have obtained from the Ohio Department of Health and measure the number or compare the number of lead tests that have been done with the number of children in that moving age group, what we find is that less than half of the kids in Toledo are actually tested for lead. In other words, about 60% of the kids who should be tested in the city of Toledo aren't. Testing is an inadequate way to find kids who have been lead poisoned, the way we do it now. And it gets a little bit more complicated because we can't take action on a home that has a lead hazard until that home has been identified as having a lead hazard. And the only way we do that is if a child has been poisoned. In other words, we're literally using the blood of children to find properties with lead hazards. And that's not right. Well, that 35,000 number is the number of children in the city of Toledo, but the risk isn't evenly distributed. Now, we don't have complete test results data since we don't test all children, but we do have some estimates for the percentage of kids likely to be lead poisoned per census tract for the entire state of Ohio. This is a study that the Ohio Department of Health commissioned by Ohio State Statistical Services, looking at both historical data and current day demographics to come up with estimates of the probability that a child in a particular census tract is lead poisoned. And those are the numbers that you see there. The darkest blue areas there, each one of those areas is a census tract, and the darkest blue areas there say that in that census tract, there's a greater than 35% chance that a child is lead poisoned. In other words, 35 out of every 100 kids living in that particular census tract has a high probability of being lead poisoned. So obviously there are a lot of kids that we're not catching who are suffering from lead poisoning. Now, in the same way that the risk isn't evenly distributed, the population of Toledo isn't evenly distributed either, both in terms of the density, higher density in the center of the city, and also in terms of race. On this map, what you see are dots that represent the population of the city of Toledo. And the blue dots represent African Americans. The orange dots represent whites. And then there are a few red and, red and green dots scattered in there that represent Hispanics and Asians. By and large, you can see that the African American population is highly concentrated in the center of Toledo. And we've drawn a line, kind of a jagged line around that population because this is what we are defining as an environmental justice population. Under federal law, you can define an environmental justice population using any number of criteria. In this case, we chose some criteria that were specified by two different federal departments. And what we did was to identify those census tracts that had a 10% higher percentage of African American population than the city of Toledo as a whole. And I think if you compare that outline area, that's outlining all of the census tracts taken together for which that is true, and compare it back to that map that we saw before, yeah, that makes sense. That is correctly identifying the area where the African American population in Toledo lives. And we also know that the African American population is disparately impacted by lead poisoning. Now, we know that, but had this moved to a Title VI disparate impact claim, lawsuit, we'd have to prove that statistically. So this is really laying the groundwork for that, should we need to do that. So this is our disparate impact, or our environmental justice population. And what defining that population as such does for us is that it gives the folks who live in that area standing to file a Title VI disparate impact claim. So we said a little bit ago, the risk is not evenly distributed, the population isn't evenly distributed, and if we combine those two things together, what we see is that the risk appears by these estimates to be disparately concentrated within that environmental justice population area. Now again, we would need to show that statistically if this were ever to go to a court case. But even just by looking at the map there, I think we can say with relative certainty that it appears that lead poisoning is pretty highly concentrated in that environmental justice population area. Now, those are estimates. We don't have complete test data, but what test data that we do, we can use to test that claim. And in fact, when we map venous puncture test results for lead poisoning by census tract and compare that to the environmental justice population in Toledo, we see that, in fact, the test results also mirror what we surmise from our estimates. And let me back up a little bit. I used a little bit of terminology there. I said venous puncture tests. There are several ways you can test a child for lead poisoning. The easiest, most straightforward, quickest way is to do a capillary puncture and then test that blood for lead. And if that preliminary test comes back positive, then there's a follow-up confirmatory test that involves actually doing a venous draw of blood. So the venous puncture test is the most reliable test result that we have, and we also can limit those results to a single test per child and determine how many children have been tested. And that's what you're seeing mapped here. Those areas on the map represent the number of children per 1,000 who had a positive or an elevated blood lead level as determined by a venous puncture. So it's very firm data, very solid data. Now, all of the maps that you've seen so far and all of the argument that you've heard so far was enough to carry the day in Toledo. We published those results and some summary information in a report that Kirwan co-authored with ABLE in Toledo. That's Advocates for Basic Legal Equity. They were the lead legal aid team that was championing the lead ordinance, along with the Toledo Lead Poisoning Prevention Coalition, of which Kirwan is a member. We co-authored this report. It went out to the public. It went to City Council. And I'd like to say that, 3 weeks later, everything was hunky-dory. It actually took about 2 years after the publication of this report for the advocacy and all of the research to finally win the day and pass the lead ordinance. The lead ordinance was modeled on one in Rochester, New York. I went through earlier the requirements of the lead ordinance, and it was passed by City Council. Now, had that not been the case, I said a minute ago that in order to really carry the day in court, we would need to be able to show a statistically significant difference between that environmental justice population and the rest of the city of Toledo regarding the incidence of lead poisoning. And so what you see here is the statistical analysis that we did. We used a Mann-Whitney test, which allows you to compare populations that aren't exactly the same in terms of being conforming to a normal distribution. If you look at that bottom distribution there, you can see that it's somewhat skewed to the right. It has a tail going off to the right. But had we needed to go to court, this would have been a very important piece of evidence to present in support of our argument. But again, in fact, the ordinance was passed. Then it had to be enacted. And we also had a minor role in the enactment of the ordinance that's ongoing right now. In order to accommodate everybody who needs to register their properties, the city decided to phase in enactment of the ordinance over a 3-year period, hitting the highest priority properties first, middle priority, and then the lowest priority properties last. So they needed a way to parse out those census tracts, and we did that. We created a map that showed by census tract basically the highest third in terms of priority, the number of children who are likely lead poisoned in those areas, next third to be enacted the second year, and the final third, property owners in those areas would need to register in the 3rd year of enactment. And this just shows you that that online tool that we created actually lets you drill down to the individual parcel level and determine whether your property is one of those that needs to be registered in the 1st, 2nd, or 3rd year. Or if your property was built after 1978, you don't have to register. This is Herbert Needleman. Dr. Needleman unfortunately passed away not long ago in July, but Dr. Needleman was the physician who pretty much got us started on the track of detecting and advocating for the treatment of children who are lead poisoned. And in fact, his quote here is very prescient for the next piece of our conversation. He said of his index case, the first little girl who he examined for lead poisoning, said it wasn't enough to make a diagnosis and prescribe medication. I treated her for lead poisoning, but that was not the disease. The disease was much bigger and caused by forces embedded in the child's life. Her disease was where she lived and why she was allowed to live there. Which brings us to a conversation, fairly brief, of how our neighborhoods and how our cities developed to be the way they are in terms of the distribution of resources, distribution of race groups, and the distribution of opportunity. Our neighborhoods resulted from historic disinvestment caused by several forces that lined up against minorities, African Americans in particular, to invest in mortgage properties and therefore invest in theirs and their children's future. There are a variety of drivers of segregation. You can see some of those listed here. Starting from the left there, zoning and land use practices, determining which land use goes in a particular area. You can, through that process, determine and steer who will live where and what facilities will be next to them. And so, for example, you might have a case where a particular piece of land is zoned for a garbage transfer plant or a sewage plant that is adjacent to an area where minority populations live. Going over to the right, explicit racial discrimination and intimidation practices. This is one-on-one racism. This is when an African-American family can't get an appointment with a realtor or does get an appointment but is shown properties that are in a different part of town than a white family might be shown. Or an African-American family may not be able to access a lending institution and get a mortgage at the same interest rate that a white family might. One-on-one racism. For the next few slides, I want to focus on these two factors in particular. urban renewal, public housing, and federal highway policies first, and then we'll backtrack a little bit and talk about redlining and housing investment practices. And again, we just have time to really just touch on these. Can't really do much more than list them. But if you look at the federal policies that reshaped urban America, you talk primarily about, on the left, the build-out of suburbia. This is white flight, you may have heard it called. And it had federal policy backing in the form of the FHA, Federal Housing Association, and the creation of the standard mortgage. Prior to that, you had to have a substantial down payment in order to purchase a home. With the FHA and the 30-year mortgage, you only needed a small down payment with a protracted loan period in order to obtain a home. Those mortgages were largely unavailable to non-white families. The GI Bill, 1944, soldiers returning from World War II, African-American soldiers were pretty much excluded from the GI Bill. Fewer than 5%, I believe, actually had the opportunity to take part in the GI Bill. There were infrastructure subsidies for new suburbs at the municipal level and also at the federal level. And then the Federal Highway Act of 1953 appears in both these lists. In this case, it appears here because the establishment of the highway system was one of the ways that the residents of the suburbs were able to access jobs in the central city and then return to suburbia at the end of the workday. You also had the demolition of urban areas through urban renewal. It started in 1949, the wholesale decimation of neighborhoods, bulldozing for high-rise public housing. You had Berman v. Parker in 1954 that provided justification for using eminent domain to seize property for urban renewal. And again, the Federal Highway Act, those highways had to go somewhere between suburbia and downtown, and more often than not, they bulldozed communities of color and other folks who didn't have access to the levers of power to resist those kinds of intrusions. I want to talk now about redlining. I know you've probably heard that term, and this is what you're seeing here. How many have seen a map like this before? I know all the Kirwan folks have. We're kind of big on redlining here. This is the Toledo redlining map, or more properly referred to as the HOLC map, Homeowners Loan Corporation. In the 1930s, in the depths of the Depression, families were losing their homes. And so the federal government created the Homeowners Loan Corporation to provide loans and the guarantees of loans, loan insurance, mortgage insurance, for families who wanted to refinance their homes, or there were also some new mortgages that were issued as well, so that those families could keep their homes. As part of that process, the federal government mandated through the Homeowners Loan Corporation that cities assess themselves for mortgage loan risk. They needed to look at all of the areas across the city and determine which areas of the city were least risky and most risky for mortgages, and then provided interest rates and insurance on those mortgages according to those assessments. The way that the Homeowners Loan Corporation did this was to provide cities with forms that they were to fill out in which they assessed not just the property, as we do today for property taxes, but also the residents of the areas that they were assessing. The area descriptions became the basis then for creating those red line maps. And on a red line map or a HOLC map, areas were rated A, B, C, or D. A being the most favorable and shaded green on the map, B, blue, C, yellow, declining, and then D, undesirable, pretty much off limits for any kind of mortgage investments. Now, looking at that form on the left there, you can see that there are several places where there are basically forms that need to be filled in. And we'll look at a few of those. And then down at the bottom is this kind of free text area for notes. And we've looked at those here at Kirwan for several cities. And let me just show you a couple of examples of extracts of what the A versus the D area redlined area descriptions look like. At the top, you've got a grade A area description And we're just showing the first few forms or the first few slots at the top of the form, and then those kind of free-form clarifying remarks at the bottom. And so we have things like the occupations of residents in that A area. We are skilled mechanics. Family income, $2,000 to $3,000, which in 1930 was fairly substantial. Foreign-born families, 0%. And then specifically, Negro families, 0%. Infiltration, meaning people are moving into that area. Infiltration of desirables. In other words, people just like the people who live there are moving into the area. We don't have any undesirables moving into the area. And then availability of mortgage funds for home purchase, ample, and for home building, ample. And then we get into those clarifying remarks. And I'll take my glasses off. A somewhat older but very fine, high-type neighborhood. Pride of ownership is highly evident. Area was well planned and homes soundly constructed. Uniform and stable population. Within short distance, the University of Toledo. Abutment to cemetery and lower grade areas should not jeopardize desirability for several years. So I guess living next to a cemetery, you kind of always know who your neighbors will be. The grade D area, on the other hand, and these are both Toledo neighborhoods, factory and common laborers, annual family income $900 to $1,500. Still no foreign-born families, but about 20% Negro families. Population is increasing slightly, but when you look at the availability of mortgage funds for home purchase, very limited. Home building, very limited. And if that percentage of African American or Negro inched up much beyond that 20%, you would see in a lot of cases that availability of mortgage funds going to absolute zero, not available. Clarifying remarks for this area description. Area lies in northeast outskirts of the city, formerly a white neighborhood, now rapidly being run down through influx of colored and low-income group of whites. Heavy relief load, high vacancy rate. Now, those are just two examples. We've actually gone into some of these area descriptions and pulled out the text from those clarifying remarks. Now, this text happens to be from the area descriptions for the city of Kansas. So if you see the word Kansas popping in there, it's not that we just wholesale moved Toledo about a few hundred miles west. This is just a different set of area descriptions. And you may be familiar with this way of representing text. This is called a wordle. It basically shows you all the words that are present in that text, and the size of the word represents the word frequency, or how often that word appears in that text. There's a B area description, upper left, C, and then D area down to the bottom there. And I've highlighted some of the words. Oops. Well, there we go. Highlighted some of the words that are most prominent in these descriptions. And you can see in the B area, professional, good, new, restricted. That was a way that you kept undesirables out of your neighborhood, was to form restriction pacts around the areas that you lived. Brick construction, stucco construction, frame construction. So fairly high quality housing. And then you look down at the D area and you see words like industrial, poor, workers, laborers, and descriptors like small and shacks. Now, I have to tell you that I'm misrepresenting this a little bit because I've left out some key information that you need to see. And the key information I've left out is the word that figures most prominently in those D area descriptions. In other words, this was the primary determinant for whether an area was D-rated or not. Very highly racialized practice. Now, I need to tell you that those Hulk maps and those area descriptions, when these maps were first discovered, it was presumed that those maps were used specifically to identify areas in making individual loan choices. There's been subsequent research that calls that into question. And it's doubtful whether these maps were widely distributed. And there's some evidence to back that up. First of all, we just don't have that many of them. There are contemporary maps that were useful for other things, specifically the Sanborn fire maps, if you've heard of those, that were used to determine fire insurance rates. We have tons of those. So we know those were widely distributed and used daily. These maps are very difficult to find. In fact, we don't even have maps for several of the cities that we know were redlined or mapped by the Homeowners Loan Corporation. The maps that we have, we had to go to the Library of Congress and request. And again, we don't have them all. We also don't have area descriptions for all the cities. We don't have area descriptions for Columbus, for example. We don't have them for Cincinnati. We don't even have a good map for Cincinnati. Cincinnati was a fairly prominent city in the 30s. But for those cities that we do have the area descriptions and the red line maps, we've been able to draw these conclusions that, first of all, even though the maps weren't used probably in day-to-day loan decisions, they were created by the people who did make those decisions. And so this is the way that mortgage lenders and real estate professionals understood the cities that they worked in. This is how they viewed their cities. And we know that's probably the case because since these area descriptions were really never meant to see the light of day, we expect that people were fairly honest and open in the way that they described the neighborhoods that they assessed. So they're a fairly rich source for us today of looking at racial segregation in our cities as it existed in the 1930s. And we can carry that forward then to present day. Now, it's been more than 80 years since the Hulk maps were created, and a lot of things have happened in that 80-year interim. In some cases, neighborhoods that were derated have gone completely away. They may have been gentrified, bulldozed, and rebuilt. There may have been A and B areas that subsequently declined, and probably less frequently, there have been C and D areas that have rebounded and come back, oftentimes because they're surrounded by A and B areas that maintained their value and their resources. But what you can see here from this Toledo redline map, and comparing that to, in this case, these are residential parcels color-coded by the year the property was built. Anything in red is a property that was built before 1950. And anything in blue is a property that was built between yellow, between 1950 and 1978. So if you think back to what we said about lead paint, 1978 was a landmark year. Basically, all the property in Toledo that's residential property was built prior to 1978. And so all of it has the possibility of having lead paint present somewhere in its construction. The other thing we know is that lower value properties, and especially rental properties, most likely haven't had the kind of maintenance that would, that maybe a higher income property would have had to ameliorate lead risks. And so low value property, older property, those two factors together combined tell us that these are areas where we're likely to see lead paint risks. Now, let me point out one thing here. There is an area in Toledo, you can see that large blue area, that was a B-ranked area, and it's more or less contained pretty much in this area here. Now, it was B-ranked, and yet it has declined, probably because of influence from the surrounding C and D-ranked areas. Even so, it's a little difficult to see, but there are some higher value properties here that, even though they're older, are higher value. And so that may be some residual of the fact that that area was not ranked quite as low as the area surrounding it. But here again, low value and old property combined tells us that these are probably areas where we're going to see high incidences of lead risk, as well as some other problems that go along with living in housing like that, like exposure to triggers for asthma. Let me just say finally that we are working to expand this work into other cities across Ohio. This map shows you the combined low value and age of properties. That map on the right shows you that combination. Those are the areas in the city of Columbus that we would expect would be at higher risk for having lead paint exposures. A few summary points here. Why is this history relevant today? Well, there are implications upstream, first of all. Policy has an explicit role in shaping community inequities. And so we have to use policy as a tool to address those inequities. There's a relationship between values, biases, and policy. We have to ask whose values are reflected in our policies in relation to things like health equity and equity overall. And we have to provide incentives for restorative investment in communities that are policy-driven. Downstream implications. Oops. There we go. We have to have sustainable restorative investment in communities at the implementation phase in order to address these long-standing issues. And this research also provides context for the longevity of the equity challenges that communities face. Our communities didn't develop into the way they are overnight, and so any kind of change that we want to implement is also going to have to be multi-pronged and long-term. It's going to have to be longer than an election cycle if we're really going to move the needle on this. We also have to target interventions to a community's unique needs and culture. And finally, we have to remember that all of this history that we've just discussed is living history. There are folks who push back against talk of reparations for slavery because they say it was so long ago, and even though we know those arguments aren't valid, it's difficult to come up against those sometimes. When you talk about things that happened in the 1930s, when you talk about things that your parents or your grandparents probably experienced themselves, or maybe you remember as a child, having your parents experience, that's a little more immediate. And it's living history that you need to understand when you go into work in a community to understand their apprehensions that they might have. So that is my presentation, and I think we have some time for questions. Or
can we get a round of applause? Great. So if anyone has any questions, I'll kind of moderate, and if you just want to raise your hand, and we'll go around the room.
So after the Toledo Ordinance was passed and certain houses were identified for interim measures, were there initiatives to help families pay for those remediations?
There were, and again, it's not remediation. It's interim measures. Remediation implies that you're actually removing all of the lead or abatement. Yeah, that was actually a point that the property owners raised in opposition to the ordinance. They said this was going to impose inordinate costs on them as property owners. So it's the property owner and not the occupant who has to pay those costs. But one of the pushbacks from the property owners was that, well, we'll just pass those costs on, and these properties will become unaffordable to the folks who live there. You're actually driving people out of housing. Well, we've seen in Rochester and other cities that that's not the case. I mean, a landlord isn't going to charge so much that they're not going to get any kind of income. But one of the compromises that was enacted was the city did seek, I believe, some federal funding and did receive some funding to provide funding for kind of the first in. In other words, as an incentive to register your property, if you're one of the first in, we'll provide you with some financial help in order to pay for those interim costs.
So owners push back to remediation. That's kind of what I was kind of getting
Yeah.
into. Okay.
Yeah, the owners pushed back big time. And in fact, one of the owners is also a state legislator. And after the ordinance passed in Toledo, during the budget process, this representative, he owns properties in Toledo. In fact, he owns rental properties in one of the highest risk areas in Toledo, added an amendment to the state budget bill. And if you know anything about state budgeting, that's a must-pass bill. The state is required to have a balanced budget by, I believe, June 30th. And so it's must-pass. Anything that gets added onto that and gets passed through, is must-pass. There's very little time to have any kind of negotiation or pushback. It was introduced in the House as an amendment. It was stripped out in the Senate and not reintroduced in reconciliation, so it didn't make it through the budget process. It's not part of the budget bill. And so now that legislator has introduced basically the same text as a new bill. So with that happening and with the possibility of pushback by some of the realtors and some of the other owners, we may yet find ourselves in a Title VI situation where we're going to go to court to defend the ordinance. Basically, the amendment that Representative Marin introduced reserved all activity related to lead poisoning to the State Department of Health, which essentially negated any kind of home rule initiatives that any city, not just Toledo, would take to address lead poisoning. So stay tuned on that one.
All right, I think someone else. Tanya, did you have your hand up?
Yes. You said it was difficult with a lot of the kids weren't getting tested. Why isn't it part of school registration?
It's a good question. It'd be great if it was. I mean, you know, kids need to get vaccinated, right? Oftentimes, lead testing is just kind of overlooked as unnecessary. You know, it kind of gets lost in the shuffle. Parents specifically have to request it, and if they don't, then it may not get done.
I was wondering about some of the other cities in Ohio. You know, what do you think is sort of driving them to the table? Do you think it's sort of the publicity of the work in Toledo, or do you think that work has already been in the works, or what do you feel is driving that?
I think it's a combination of things. I think Flint was a big driver of all of this. It brought lead back into the public awareness in a very big way. It's also created some confusion because, as you saw from my opening graphics, a lot of people, when you talk about lead, they think you're talking about water. And that is a separate issue that needs to be dealt with. But this is both more acute and longer term in terms of the exposure to the most children. So it's part media exposure. I think that part of the interest, in fact, I know the interest in Cleveland is directly related to the ordinance in Toledo. Having a conversation with their legal advocates tomorrow, in fact, to come up with a similar strategy in Cleveland for their lead legislation as we did in Toledo. I'd say those are probably the two main drivers. The ordinance that the Toledo ordinance was modeled on was passed in Rochester something like 10 years ago, and it's been a proven, it's been proven to reduce lead poisoning in the city of Rochester. So it's a success story that, somehow got lost on the national scene. And so hopefully this will maybe resurrect those kinds of concerns.
I've got a question, actually. So when you were talking about the way that Toledo and other areas currently deal with lead, which is that it's not proactive, it's reactive after kids are already poisoned. Yeah. Is that the status quo nationwide for the most part?
Yeah, pretty much. Health departments don't act until a child's been, because it's public health, and so they don't see it as their. Plus, they're under resourced. They can't go door to door and do lead testing. Nor can city departments that are responsible for doing those kinds of things. In fact, when this work started, the data that ABLE in Toledo provided to us was code enforcement data. And code enforcement, if you're not familiar with that process, oftentimes a complaint is filed because somebody isn't mowing their grass. Their property looks like crap. Or, a city worker is driving around the city and they happen to notice some broken windows or whatever. It's largely external, whereas lead paint is an internal issue. And so by and large, code enforcement isn't prepped or equipped or staffed up to do that kind of internal inspection either.
And as a follow-up, so legislative efforts that have happened so far, like in Rochester and Toledo, have those all been essentially municipal-based? Are there any efforts at the state level in any states?
That's a good question. I think there have been some state-level efforts. I'm not coming up with any off the top of my head. I do remember there was at least one. But by and large, I think this is pretty much something that state departments of health devolve to the county and municipal health departments, because they're on the ground. They have the most immediate access to the properties, to the children, and to the resources to deal with this problem. So, yes, sir.
Just a couple of comments. First off, the Center for Disease Control, I apologize for being a little bit late, but had another meeting before this one. The Center for Disease Control, so from the federal level, has guidelines that they suggest to states for addressing this issue. But, we live in a nation that is state rule and then on a local level, home rule, so that some of those guidelines are not followed as strictly as we would like for them to be. And within the state of Ohio, even though we have a statewide health department, our state health department, relative to other state health departments, hasn't been the strongest. So that if you look at the annual evaluations from the Health Policy Institute of Ohio for various issues regarding public health, our state ranks very, very, very low. The other piece, so this whole thing that David has emphasized about how policy, or what we refer to as structural determinants, influence social determinants, the conditions where people live, and that those social determinants have consequences. The social determinants describe the conditions in which people live, and then there are consequences of those conditions. It's kind of a common thread throughout a lot of the work that we do here at Kirwan, and in my opinion, again, sort of underscores the importance of the voice that Kirwan has, and not just, in this case, lead poisoning, but in a lot of different areas. So that I don't know this to be a fact, but it'd be my guess that if, for example, David overlaid those areas that are at higher risk for lead poisoning with those areas that are at higher risk, for example, of infant mortality, that we would see significant congruence in those maps. And where Toledo specifically is concerned, most recent statewide infant mortality data we have on a state level suggests that black babies in 2015 in our state died at 2.7 times the rate of white babies. That's a pretty significant disparity. In Toledo for 2015, black babies in Toledo/Lucas County died at 10 times the rate that white babies did during the first year of life. That is, for somebody who has been doing this infant mortality work for the better part of 30 years, that is the worst disparity that I have ever seen. Now, it's just for 1 year, so that, we don't, especially for relatively small local areas, we don't make a big deal of that stuff for just 1 year. But that it happened suggests to us how troubled the situation is in that community. And you couple that with the fact that the state of Ohio has one of the worst black infant mortality rates in the entire nation. And so this whole thread that I've suggested is common in some of our work, that structural determinants, policies, practices, systems influence social determinants or conditions, and those conditions have consequences. We don't doubt for a minute that if, as we look at things on a racialized basis for, you name it, quality of life parameters, that we're going to see a common situation. What's important about that also is then that our interventions, our things to correct this, have to take place in what I refer to as a targeted universal kind of way, where we help those communities that are most adversely affected by this stuff in a preferential sort of way. And we haven't gotten there in this state. We're nowhere close to that. But this kind of stuff adds to the importance of eventually adopting that kind of mechanism for intervention. Thank you very much for your question.
Oh, absolutely. And we have done that overlay of infant mortality and lead poisoning and what we call our opportunity maps here at Kirwan. And there is a very high degree of correlation between those areas. This one happens to be the map for Franklin County, and we're not showing lead poisoning per se, we're showing opportunity, which rolls up about 20 different indicators of the social determinants of health. And you can see that we have this kind of reverse L pattern that we generally see with the distribution of disparities in the city of Columbus and Franklin County. And when you look at the lead poisoning map that unfortunately I don't have here, but it also follows that very closely.
One other comment I'd like to make that I think would be an interesting study. Because Toledo is on the northern border of our state, which then places it right on the shoreline, for poor communities, a lot of people fish on their own in order to provide food. And we know that our Great Lakes have a high level of mercury. Just like lead, we don't have a good way of removing it once it's in our bodies. The same is the case with mercury. And mercury, of course, also causes harm. I wonder, as far as I know, we don't have any strict regulations on measuring mercury levels. But it might be interesting to look at the correlation, or if there's any correlation between high ingestion of fish that communities get versus lead levels, because I'm betting that there's a cumulative adverse effect in these communities.
Sounds like work for Glennon.
Lake Erie is the dirtiest of the Great Lakes. It is the most polluted. I don't know if that means with mercury specifically, but I know in general it is the dirtiest of the Great Lakes. And a lot of that is